Hello, caregivers. And I want to say today we're going to be talking about the difference between two agencies that people get a lot of confusion with. This is the difference between a home health care agency and a home caregiving agency. Now, to explain a little about the two, and then I'm going to break them down to you. First of all, a home caregiving agency is non medical, and they provide in home services such as laundering, feeding, meal preparation, bathing, and other daily living activities. Whereas a medical caregiving agency, which is a home caregiving agency, they provide in home services such as nursing care and various forms of therapies, physical, occupational, speech therapy, and so much more. But to break these down in different groups, we'll start with a home caregiving agency. Now, what they provide, this non medical agency, they provide um, care for uh, individuals that are paid or non paid family members, and they can be able to receive these even from outside agencies, home caregiving agencies. And what these agencies will do, that they will provide them with trained caregivers. These non medical caregivers in general, they provide some of these services. They'll either help with grooming, bathing, dressing, toileting, showering, and so forth. Medication reminders help with moving around, getting in and out of bed, meal preparation, feeding, light housekeeping such as dishes, laundering, cooking, vacuuming, washing clothes. They'll also provide companionship and friendship. Now, there are times that a home caregiving agency will provide more extensive caregivers, and these are known as a DSP, which myself, I was a DSP. That's a direct support professional. And even though these are non medical caregivers, they will provide some form of medical assistance. And usually, what they will do, even though the medical limited services they provide, um, what they have to do is they have to go through extensive training. We had to do a lot of that all throughout the year. And in order to keep your licensing, you had to make sure that this was in place. All of your training was done in place, so too. And some of the things, for example, we went through medication administration training, and this was a 2 week course in order to understand a lot about medical procedures and things of this sort, or some of the equipment that we would use and so forth, how to operate medical equipment and devices and so forth. And with the medication, we had to learn times, dates, dosages, etc., and things that a doctor would expect, certain doctor's notes, things of this sort. And we were also required to follow the orders of the physical, occupational, and speech therapists if a loved one may have gone through rehabilitation and needed these services. And also, again, these were non medical caregivers. And so the DSP wore a lot of different hats in order to help the loved one to receive professional care and to stay inside of the home. And as a DSP, um, with some of the non medical skills, I know with myself as a DSP, some of these skills that I received, these are some of the limited skills that I'd like to be able to teach the Team B, your additional caregivers, through my program, though, to my structured holistic service schedules service program. And this is to be able to support them so that they can be able to provide general caregiving services. Now that we talked about the home caregiving agencies, our next thing is to talk about home health care agencies. Now, these are medical professionals, and usually for a family to receive this service for the loved one, it has to go through a doctor. A doctor may give an order for them to have this, and it's usually provided to help older ones if they're recovering from a serious health issue, or and it's less expensive and it's more convenient for them to be able to stay in the home versus being in a hospital or nursing a home. And these usually will require some of the following services: at home physical, occupational, or speech therapy, monitoring serious illnesses and unstable health issues, pain management, injections, wound care for pressure sores or surgical wounds, intravenous or nutritional therapy. Now, as a main family caregiver, these are some points I'd like you to keep in mind. If your loved one is not insured and they cannot receive help through a home caregiving agency, the services that you will receive through our team, SHS&S team, will help you to generate additional caregivers, and we're going to train these. And as I brought up the two, they'll provide some of the general caregiving things that I mentioned earlier at a fraction of the cost. Of course, they won't be professional, but they will provide some of the general caregiving. Also, as a main family caregiver, it's important for you to understand that even though you may not receive help through a home caregiving agency because maybe their insurance doesn't pay for it, you'll probably still need the help of a home health care agency. If your loved one has medical issues, then their doctor may require that they have this so too. And something that I like you to keep in mind, this is something that we had to appreciate as a DSP when we worked through Home Caregiving Agency. We had our own binders. You heard me talk a lot about binders with the training. Well, we had our own binders that were filled with the individual's medical and caregiving needs, about their information about the ailments. But the home health care agency, the nursing staff that comes once a week or whenever the need is, your loved one may have issues, they too, their company will have their own binders also. And that's going to be filled with that person's medical issues and procedures, the things that they're going to take care of as they come for the care. These two agencies are not affiliated with one another, and even though a DSP at times may have to assist with the home healthcare agency when they come into the home, or the occupational therapist or physical therapist and so forth, even though we may have to assist with them, all the information concerning each agency stays separate from one another. You keep their stuff in their binder. The home caregiving agency keeps their things in their binder. And this is something sometimes very important that you keep in mind also, that when you receive our training and create a personalized binder, I want you to keep these points in mind yourself. Whatever you keep from the Structured Holistic Service team, that's your personal property, the property of your home or your family, versus the information that you may have if you have a home caregiving agency. That's not to be shared or kept separate from one another. So hopefully this concludes an explanation of the difference between a home health care agency, versus, which is a medical agency dealing with the nursing part, nursing care, versus a home caregiving agency dealing with non-medical caregiving needs. And hopefully this gave you a chance to have a clear picture of the two. So again, as always, I want to say I hope the best for you as you deal with your daily challenges of never-ending caregiving. And hopefully this is can be something that can also add to giving you relief and support. Thank you, and I hope the best for you and your family.